Hey guys, afternoon. My name is Jason Determann. I'm one of the orthopedic surgeons here at Bayside, and today I wanted to spend a few minutes and talk to you just about your shoulders at home. You know, this is a hard time for everybody, and we can't get out always to the gym and doing things that we enjoy doing. And so today I wanted to give you really 5 helpful tips that you guys can be doing at home to either maintain the health of your shoulders in these isolated environments that we find ourselves in, or if you're dealing with a shoulder problem, to really give you some hints and some tips that you can take with you to help alleviate the shoulder pain at home. The shoulder is a complex joint. As we all know, we've all struggled with shoulder issues in various tasks throughout the day, whether or not it be throwing the ball with your son, carrying groceries in, mom's transferring loads of clothes from the washer to the dryer. We all have seen it, we've all felt it, we've all had shoulder issues before. The reason why I think we have so much issues with our shoulders because it's such a complex joint. There's not another joint in our body that's got so many what we call degrees of freedom. That is where the ball and the socket are allowed to move in so many different directions. Unlike our knees or our elbows, which serves as primarily hinge joints, the shoulder has got the greatest degree of motion as any joint in the body, and I think it predisposes it to seeing some problems that we find ourselves as orthopedic surgeons here on a daily basis. I myself have an orthopedic surgeon here at Bayside. I've been here for 5 years, have practiced and done fellowships in shoulder and elbow surgery. And so hopefully after this discussion you guys can each take a piece or two of information from it and apply it to your life at home to help fix some of the shoulder problems that we see commonly in the office. In terms of the shoulder, the first and probably the foremost thing that we see in moms and children alike, if you've ever heard you need to fix your posture, that's true. And so the first thing I want to talk to you guys about in terms of shoulder health is your posture. If somebody's ever told you have poor shoulder posture, you give me a thumbs up, let me know. I know I am guilty of it myself. The shoulder posture, people will refer to as rounded shoulders or a humpback, where their shoulders are oftentimes poked out in front of them. What that means, an easy way to see if your shoulders are kind of in the correct posture, is just simply stand up. Stand up and let your arms hang down by your side. Your knuckles really should be pointing towards the outside of your body. If you find that those knuckles are pointing in, then oftentimes mean that those shoulders can be kind of pushed forward. What that does is that puts a lot of different stress and strain on various other muscles around the shoulder and can lead to some potential shoulder problems down the road. And so first and foremost, I'd like to start off with looking at your posture. An easy thing to do at home to check your shoulder posture basically is doesn't need fancy equipment. All you need is a wall. And so stand with your back flat up against the wall and put your heels 2 or 3 inches from the gently rest your bottom against the wall, and then the tips of your shoulder blades should come flush with the bottom or to the back of the wall. When you're in that position, that basically tells us that your shoulders are in the correct kind of alignment with your spine. We see a lot of shoulder issues that come into play with some neck or some upper back problems and vice versa. And so first things I'd like you to do is just make sure that overall we're developing good posture. Today's day and age, and particularly whenever we're kind of stuck at home, I mean, there's a lot of leaning down, texting. There's a lot of times where we're stuck, we can't get out and work, and so we're stuck at the desk at home, sitting in a chair for 8 hours a day and stuff. And so maintaining good shoulder posture at home, I think, is the first key successful thing that you guys can be doing to help out or to maintain good shoulder health. The second thing that I want to talk about is the flexibility of your shoulder. As I alluded to earlier, your shoulder has got so many degrees of motion that maintaining that flexibility is crucial to the longevity of a shoulder. There are a lot of conditions and problems that we see in the office on a daily basis that have to do with either a shoulder that's too tight or too loose. and stuff. And so shoulder flexibility is key. This is something that's easily checked, doesn't need any fancy equipment. Similarly, if you can get back against the wall, start off with good shoulder posture, you can check your shoulder range of motion. Basically, you should be able to take those arms and lean them flat up against the back of the wall while still maintaining your shoulder blades against the wall. If you're able to do that, then you've got a relatively normal range of motion. Basically, any deviation from that probably points to that you've got some tightness in your shoulder somewhere. Like I said earlier, there's a lot of other conditions, whether or not it be the high school throwing shoulder or the elderly gentleman with primary arthritis in the shoulder, that have to do with that range of motion. And so we oftentimes are able to identify that and recommend a home-based type of stretching program to help fix the problem. Well, I like to be a little bit more proactive, and let's just maintain that shoulder flexibility, or what we call laxity, to allow the shoulder problem not to develop. That's probably easier than having to take time and come see us in the office. When you look at shoulder flexibility and range of motion, basically, there are a lot of different stretches, a lot of different exercises. I'm sure you've probably done them at home, and I'm sure you probably at some point talked to somebody who has either had shoulder surgery and talked about the rehab and the therapy that involves getting that shoulder range of motion back to its functional state. I'm going to post, after this short video, I'm going to post a good website basically that you guys can utilize as patients to give you some really key fundamentals in terms of some very basic stretches to be doing. We do want to be sure that we're doing an appropriate stretch before, as well as after some of these heavier activities that we use our shoulders for. And so if we can maintain that flexibility in our shoulder, or identify some tightness that we didn't know we had and be able to stretch that out appropriately, I think we give ourselves, again, a better chance to maintain that healthy shoulder. The third important thing that I believe is crucial for maintaining healthy shoulders at home is the strength, and it's primarily in your rotator cuff. Raise your hand or give me a thumbs up if you've heard of your rotator cuff. It is a series of really 4 muscles that make up the shoulder, that really serve as the primary motor of your shoulder. I hope you guys can see this okay. Basically, this would be looking at a front view of your shoulder if we take all the skin off and we're just looking at the bones and the muscles. The red is the muscle, and it forms the white areas, which are the tendons of the rotator cuff. And again, there's 4 of them. You have one big muscle that comes off the front part of the shoulder blade. You've got one that comes off the top part of the shoulder blade, and then similarly 2 that come off the back. What these rotator cuff muscles do is, if you were to open up the inside of a shoulder joint and look, hopefully you guys can see that okay. The ball and the socket are deep underneath there, so they really surround that ball and socket like a glove, and they function to pull in different ways, to elevate your arm, to rotate your arm, and primarily to work overhead. If you're active in the gym, and we know that you're probably not spending the right amount of time on some of the important muscles in your shoulder. It's hard to see a well-defined rotator cuff, unlike it is your chest or your shoulders or your deltoids or other important muscles. But for the gym rat, or for grandma at home, rotator cuff strength is crucial to maintaining health of your shoulders. There are really 3 or 4 basic rotator cuff exercises that I would encourage you to look at. Again, these will be available on a subsequent post with a good resource that you guys can use at home that can maintain or hope to maybe improve upon your rotator cuff strength. These don't require a lot of fancy equipment or a gym membership or anything, and so particularly, like I said, while we're at home, all you need oftentimes is just a little light resistance band, or even a little light 2 to 5 pound dumbbell. These are exercises and weights that don't require brute strength to be able to do, and if you honestly can't do 15 or 20 reps of some rotator cuff exercises, then the weight's too great. You need to back down on either the level of resistance or the amount of weight that you're lifting. You're looking at basically toning that rotator cuff. As we said, rotator cuff serves a very important function in terms of lifting overhead and stuff. And if you've all had pain when you're reaching up in the cabinet or getting a gallon of milk out of the refrigerator, oftentimes, and you see somebody about it, they'll say that's some tendonitis in your rotator cuff. Well, these are muscles that, again, when we use them, we need them, but they're often neglected and stuff. And so equally important in terms of strengthening some of the bigger muscles around the shoulder is also strengthening your rotator cuff. The fourth thing that I want to touch base about in terms of maintaining shoulder health at home is just the general use of modalities. We get lots of questions as orthopedic surgeons in terms of, do I ice this? Do I heat that? When is massage good? When should I use topical rubs and muscle rubs and creams? And I think there's utility really in all of that. Oftentimes the use of ice and heat and massage and some of these things is thought after the case, but again, I think I'd encourage the use, even if you say, look, Dr. Determann, I'm not having a shoulder problem, I'm healthy, I don't have any issues. Still, these things can help you to maintain that shoulder health while you're at home. The way heat works primarily with shoulders is, if you think from a basic science standpoint, heat causes the blood vessels and these little bitty muscles to dilate, or basically to open up. It causes a relative increase in blood flow to those areas that are heated, and so for that purpose I think it's very helpful for treating some of the muscles around your shoulder and stuff. And so using a heating pad for 15 or 20 minutes either before some exercises or before some type of intense activity is a good way to help loosen those muscles, to increase that blood flow, to hopefully prevent any type of injury. Heat can also be very helpful if you have some soreness in some muscles, particularly throughout the day, and you're stretching and you're heating can be an effective tool at home, basically to take some of the soreness out of the muscles. Ice, on the other hand, does the opposite. It constricts those little bitty blood vessels that are in these muscles, and so it helps to kind of shut down the muscle. I oftentimes think of, particularly in relationship to exercises, is to heat is good beforehand and ice is good afterwards. And so once you've kind of done your exercises, once you've kind of had a training session or just been using your shoulders a lot and they're taking the brunt of it just through daily life, ice is a good tool to use at home to kind of reduce some of that inflammatory component that often accompanies shoulder pain. Massage can be very, very helpful as well, and so I know a lot of you guys out there are big into foam rolling, and then that is a good utility. I'm not recommending going out and getting a fancy sports massage. Those can definitely be helpful as well. But some simple things to do at home to isolate or to massage some of these key muscles around the shoulder that are either sore after an exercise or sore for no reason. An easy thing to do at home, again, is to get a tennis ball and a sock. Hopefully you guys can find something like that around the house. And again, all you need is my favorite tool for a shoulder is just a wall. Put the tennis ball and the sock behind the wall, find that hot spot, and just do a little gentle massage on that area that can help to loosen up that muscle as well. Probably last, but definitely very, very important, is just some primary preventative tools. And this, again, hopefully we catch you early before these shoulder problems can arise. And what I mean by primary prevention is not ignoring your shoulder and knowing activities or stresses that you place across your shoulder that can potentially, if done repetitiously, can lead to some shoulder problems and ultimately seeing us in the office. These are things, for instance, if you notice that every time you go to unload groceries and you're putting multiple repetitive things, or you're unloading dishes, and every time I get to that top shelf I know I'm feeling a tweak in my shoulder, well, simply modify that activity. And that's doesn't mean to go not to put the dishes away or to tell somebody else to do it, but if you have that available to you, that's one option. The other option basically would be to get a step stool, and you know what, I'm gonna try to keep my repetitive overhead activities to shoulder height. other options basically, are going to be what we've talked about in terms of stretching and strengthening. And so, if you're going out and you're coaching youth baseball and you're going to be going out and throwing, making sure that you have a proper warm-up, making sure that you have a proper cool down, using some of these modalities that we talked about can be very, very helpful and very beneficial. Let's see. I hope you find that somewhat educational from our standpoint. Obviously, we are here. If you liked what you've heard, let us know. Leave some comments. We're happy to take as many questions basically as possible, or look forward to hearing some comments on some other topics that we can be talking about during this time where sometimes access to us or offices is not readily available. Let's see, we've got a question regarding exercising and shoulder. Should I still exercise if my shoulder hurts? I think that's a great question, and I think most of us can probably find the difference between shoulder soreness and shoulder pain. If you're really exercising, you should not be hurting your shoulder. Your shoulder should not hurt while you exercise. It is normal to have some muscle fatigue and some soreness post-exercise or after exercises, but if you're having pain during an exercise, that means that we probably need to be looked at, and I would initially avoid some of those exercises and do a very simple home-based treatment with some relative activity modification, icing and anti-inflammatories, and giving yourself a little bit of time before going back into those exercises that induce that pain. Let's see, we got another question about what we find ourselves doing a lot now these days is, look, I'm all day on my computer from home, and it's taking a toll on my neck. Any helpful options? I think, and that's a great question. Biggest options and biggest things is, I think it'll allude to that first principle that we talked about, and that's going to be looking at posture. When you're sitting down, basically the correct sitting posture, is going to be where your feet are planted on the floor. You have to look for a good back support, basically in a chair, and so you want your entire back to be flush or have some contact with the back of your chair. Oftentimes those are the benefits, particularly if you're looking down, adjusting the height of your chair to where you're keeping your neck in a more neutral alignment, so you're not tilted down, you're not looking up. I think some of those are the helpful things to be doing to hopefully prevent some of these problems. Well, I hope you enjoyed what you seen. There's going to be a lot more to come from us here at Bayside. Please, again, leave your questions, comments, any future topics that you'd like to see on some of these videos for us. We're always happy to get your feedback. If you can, please join us. I know Dr. Savage is going to have a talk tomorrow, and so please check back with us in terms of timing on when that will be, and we hope to see you there, and hope you enjoyed this. Thanks a lot for your time.